Too many of us are silent about sexual health. We whisper about it, we hide it, and sometimes even deny it. But silence has consequences. An infection you don't talk about can change the course of your life. And here's the truth: sexually transmitted infections, STIs, are not just someone else's problem. They are our problem. They affect our friends, our families, and our communities. Welcome to the Kampala Podcast, and today we launch our reproductive health series because it's time to speak openly, boldly, and honestly about issues that matter. Joining me today is someone who understands this deeply. Dr. Mbuga Elvis is a dedicated medical worker at Royal Pharmacy in Kampala. He is known for being hardworking, experienced, and committed to improving healthcare access in his community. Beyond his profession, Dr. Elvis is passionate about breaking the stigma around reproductive health and making complex medical information simple and clear for everyday people. That's why he is the perfect person to help us cut through the myth and fears surrounding STIs. Dr. Elvis, welcome to the Kampala Podcast. It's an honor to have you here.
Thank you, sir.
Let's be real. People don't like talking about STIs. Why do you think that it's like that? And what does silence cost us as a society?
Before we start about the STIs, currently, if a such question comes to me that what could be the causes, why people are shy about the STIs, and what could be the consequences that can cause the community about that silence,
Yeah.
first and foremost, I can start with the shame and the guilt that embarrasses. Most of the people in the community we don't sure know about the STIs or anyone has any idea about STI, but because people have shyness in the community about airing out their STI status, it can be one of the causes why people feel shy to share their STI status.
Yeah.
Some people are guilty about they are guilty in the community, whereby it's very rare to find someone enclosing such information with a friend or with a relative about how he or she could be about their or his sexual health at large.
Yeah.
The second one could be about the fear of judgment. You know, about sexual health, most of the cases we face personally, there could be something that you cannot air out to anyone. There are things you should disclose with people. If you one day come up when you're seeking help or you're seeking something about any encouragement or counseling from anyone, even if it's not a medical worker, but many people have that fear to be judged. That if someone could ask you, how did you get those infections? It's something you can't come out one day. You share with someone, tell someone, I have some STIs, I have some urinary discharge, I have some pain when I'm urinating, have some itching, and so on. So people have that fear of judgment. Someone may judge you that maybe you went wrong somewhere, maybe you did something in indoors which are not right, and so on. So there's that fear of judgment, whereby people fear to be judged by others in the community.
Yeah.
Another factor, we have about lack of awareness. Many people have problems about their of the general health from early to toy, but most of them they have that less information. They have misinformation about their health generally. You find someone may have some certain signs of infection. Let me say someone may get a discharge, someone may have about lower abdominal pain, someone may have about dysuria, someone may have about genital rashes and lesions. But people have that less information about what could be the cause of such signs on his or their bodies.
Yeah.
So some people try to keep indoors, whereby they try to keep quiet. They think it is something simple, whereby when it keeps on growing, it ends up affecting the people and they are all that right. So people have less information whereby some people have that little information. They can't go deep to know what are infections, what could be the causes, how do you manage them, how do you prevent them, and what could be the signs and symptoms someone could see or could feel and end up saying that I have some infections or to seek the medical help.
Wow, exactly. What you said is true. And for me personally, I think I'll be fear to be like have that fear to be charged, especially when I go to a practicing doctor and or even talking about it with my friends. That kind of judgment. Actually, what you said is really true.
That fear of judgment, someone may think something broad. Someone could ask you, how did you get those infections? Maybe you're doing something contradicting what we know. So that shyness in the community or feeling guilty.
Okay. So, doctor, now you've worked with so many people. Can you share a moment or story that shows how STIs impact not just the body, but a person's dignity, relationship, and even future?
Uh, First and foremost, I'm a medical doctor who has spent in field something like 5 years so far.
Yeah.
But I've been interacting with different people about STIs, not probably my fellow medics, but even the community at large, because we work on people from different communities.
Wow, that's
And we share
nice.
ideas as medics about how we can come up with a solution of preventing or eradicating out anything about the STIs. Because it's something you can handle if any one of you can come up with an idea or anything about any extra knowledge about how can something happen and how can we go further with it in
Yeah.
cases of eradication. So about any story I can tell about how can this support the community or any personal about the health and the community at large.
Yeah.
First and foremost, these infections are transmitted from head to head, from different person to another in the community. That's what I can start with. The
Oh,
second thing, the first one I can consider to start with, it's all about the economic burden. Most people, this one can affect the people community wise because people look at their pockets. Someone may end up hindering what he or she is feeling because of the economic burden. For example, someone may fear to go to the hospital for checkup because of money issues. That one can cause you because you're going to transmit some infection, the so-called infection, from yourself to another person through different transmission modes we are going to talk about time to come. But because that one you developed the fear from the start because you didn't identify exactly what you're suffering from. Another thing, the other cost which can come up as a problem, maybe to the community and to the person at large, it's about the health complications that can come out as
yeah,
a
for the
result of
future. Yeah.
STIs. For,
Mm-hmm.
the, for example, we have infertility. These days, we have what we call primary infertility and secondary infertility. Many ladies, let me talk about the reproductive age. People suffering about the suffering from primary infertility, whereby people ending up failing to get kids because of infertility. But
Yeah.
what could be the cause of the infertility? STIs are one of the common causes of primary infertility. Currently, it's becoming a problem to Uganda and to other countries at large because the people are unaware of the information about STIs. They are taking STIs to be something easy and simple and common as we take other diseases like flu, but it's something that can enter in your body and it causes you further and future complications that may even end up costing your life, even failing you to get a kid in future.
Oh,
So those are the health complications we talk about. For example, infertility, about the prolonged hormonal imbalance, whereby the hormones of the body are not balancing because of the bacteria that destroyed the organ functions.
yeah.
Another problem that can cause the person or the community at large could be about the social and psychological impact. Many people are facing the problem of mental health. Mental health comes in as a result of many causes. For example, people come to facilities, we test them. It's very bad and it's not easy to break bad news to someone, telling someone to be HIV positive, because some people end up getting stressed, they die of depression, they get psychological disorders. So we take HIV to be under the STIs, if some people could not know, but HIV is under STIs. So
Yeah.
take that scenario, you've went to the facility, you're tested and you're positive, but you were unaware about your status before you went to the facility. So people airing out those news of bad news, they say breaking up with the bad news, like someone you're HIV positive. Advising someone to start up with the tablet is not an easy deal. So people end up getting mental health problems, they end up dying of depression, they end up dying of stress and other psychological impact.
Wow.
That's what I can say about how STIs can cost the community and the personal health at large. Another problem I can say about the problems about the organ dysfunctions. For example, we've
Mm-hmm.
seen people suffering, taking things to be easy, like someone may get simple UTI, let me say simple UTIs. So that simple UTI you call it simple, it can go further even to cost you your uterus. Let me talk on the side of the women
Yeah.
because you took it to be simple. So it has so many complications. We are going to talk about them time to come, and we shall see how these STIs can cost you or complications that can come out as a problem of STIs or anything that can come out as a problem because of you failing to identify the problem you have because you delayed or you didn't mind to look for the medical attention.
Wow. It's amazing. Like a lot of things actually that are happening in our life, but we don't know all. We didn't have anyone to tell us about those things, and really thank you so much. Now, for those listening who want to understand the basics, what exactly are STIs? And for you,
Okay,
like, how
thank
do
you.
you define them?
That was the main root actually. It's the main stem of the game.
Yeah.
It's where we're waiting for. Uh, STIs actually, each letter stands for a different word. Let me start about the breaking it down from head to toe. So STIs, S stands for sexual. I think if I'm to talk about sexually, anyone can understand that.
Of
Sexual is
course.
anything that happens after going into a sexual intercourse with someone or between two people. Let me use that word, two people. And then
Okay.
when we talk about the T, sexual, it means transmitted something from one person to another.
Mm-hmm.
The T.
Mm-hmm.
Then I is an infection. The definition of an infection, it has so many definitions.
Mm.
The first one, an infection is the presence of anything like an organism or a microorganism in the bloodstream that cannot be seen with the own eyes, but it can cause dysfunction or organ dysfunction in someone's body.
Yeah.
That's one I can use. The easiest one I can use is
Mm-hmm.
the presence of a microorgan. It could be a bacteria, it could be a fungi, it could be a virus, it could be a parasite, it could be a protozoa in someone's bloodstream that when it intubates, it can cause any organ dysfunction in someone's body system.
For me, actually, I thought it is just a virus, so I didn't know that it can also even be a protozoa or all other kind of bacteria
Yeah,
you've talked about.
yeah, because when we talk about infection, we have different types of microorganisms, let me say.
Yeah.
Because you're going to sit down there when we are talking about the causes of STIs. We have
Yeah.
different causes of the STIs. For example, we
Yeah.
have
Yeah.
different types of microorganisms. When you go to microbiology, or
Mm.
those people who did the lab, most of the microbiology, about different types of microorganisms.
Yeah. Yeah.
Microorganisms, these are organisms which you cannot see by our naked eyes, but in real life, they are there in our bodies and in the surrounding environment.
Mm.
So these bacteria, when we talk about the STIs, remember most of them they are caused by bacteria, but there are those which are caused by virus. For example, HIV. It's not a bacterial infection; it's a virus infection. How about
So,
emphasis zoster? It's also
so, so is HIV part of the STIs? Like,
exactly.
oh, oh,
Why do you group each other STIs? Because it's transmitted from one person to another under the unprotected sex, and we're talking about the sexually transmitted diseases. So
mm,
group it under STIs because each transmission mode is under the unprotected sex
yeah,
between two infected people.
yes,
So when you go back to the head, I was breaking down the impact of the STIs.
mm,
The definition, I talked about the definition of an infection. So when I come up with the definition, STIs, the definition is these are diseases that are transmitted from one person to another through unprotected sex by an infected person. We don't end through unprotected sex because
mm,
I can have sex with someone when we are unprotected, but when all of us we are negative,
yeah, exactly.
none of us is sick. So where will I get the infection? Because we're talking about the sexually transmitted. So
Mm,
when you end about talking, is the diseases that are transmitted from one person to another through unprotected sex will end there. To me, if I'm marking, I mark you wrong.
Yeah.
Because we can have unprotected sex, but you have to get that infection. One of us should be infected or should be having the disease.
Yeah.
If I'm okay or I'm negative and my friend is negative, we come into sexual intercourse. You mean can we get sick or any of us can get sick because none of us is negative? So we don't have any presence of the infection between any of us.
Yeah.
So that means we have to talk about these are diseases that are transmitted through unprotected sex, and we have to mention about unprotected. If it's protected, I will not get sick because it's protected. Yeah, it should be unprotected. From one person to another.
So you've talked about so much about unprotected. What's unprotected, to be honest?
Unprotected, I mean, let me talk about, people nowadays, they use the simple word, actually they call it STIs in the community. When you talk about, when you ask someone, what do you mean by STIs? They mean about the condoms. What are two types of condoms? What about the female condoms? I know many of you don't know them, but they are there.
Wait a minute. They are there? Like, what do you mean?
Like they are there in the community. They are made. They are manufactured.
I thought.
Yeah. It's not for men only.
Okay, I had another question, but I think let me just reserve it.
You can ask. So, when you talk about unprotected, when someone comes up, he uses a condom or he wears any rubber, latex, something, let me call it a condom. That one, the condom will prevent that direct contact between the two private parts. So it means even if someone is positive or someone is sick of any disease that can be sexually transmitted, that person will end up being safe. So that's what I was meaning when I talked about unprotected direct contact.
Okay, I understand. Now, like I think we talked about the behaviors and conditions. Like you talked about unprotected sex, and also when one person is sick, another one is okay. So this person who is sick can transmit to the healthy person, right?
So.
Okay. So now, so many people are afraid or unsure because they don't know what to look for. Now, Dr. Elvis, what are the most common signs and symptoms of STIs that people should be aware of?
Exactly. That's where the stem is.
Yeah, that's
the signs, the definition.
Yeah.
The basics mainly. The signs, the management, the prevention, the transmission, the causes, and the risks.
Yeah.
So when we come about the signs and symptoms, I will start with the meaning of the word sign. There are two words many people don't know the difference. One what we call a sign and a symptom. A sign, it is something that you can see by your naked eyes, although something anyone can see that you have something. Let me say like about the rash. When you have rash, you yourself you can see it, and me your neighbor can see that you have rash. That's a sign.
Yeah.
When it comes to a symptom, something you're feeling personally in your body is symptom. You feel it, you're not seeing it, but you're feeling it.
Oh. So you just you just feel it in your body. It's not like you see a sign in your body.
You feel it.
Oh.
Yeah.
Okay.
Symptom you feel it, sign you see it.
Oh wow.
So when you come to the facility, for us we ask you the sign you see and what you feel. That's the symptom. Me as a medic, if you have difficulty in breathing, let me say difficulty in urination, I can't see it by my naked eyes when you come to the facility, when you have STIs. But it's you to tell me that, Musao, I have a problem. When I urinate, I feel pain. That you feel pain, you personally, not missing that you feel pain. So that's the difference between the sign and the symptom.
Okay.
So let me start with mostly with our female gender. And the signs and symptoms they get. First, what about the vaginal discharge, vaginal smell discharge? Naturally, these ladies were, say they were created, their private parts are open. One, naturally, the vagina, it has a normal flow. A normal discharge.
Yeah.
a normal discharge because the vagina is containing some normal pH. The normal floras, those are bacteria that help to maintain the pH of the vagina normally, and they have the normal, what we call the normal discharge. Normally, that normal discharge, it should be colorless and sticky. So when I talk about the vaginal discharge, vaginal smell discharge, this pattern of the STIs should be bringing out a different color of a discharge with a different odor. For example, one of the three types of discharges that show that someone is having infection. The first one, they have a discharge that's milky discharge that looks like milk. How about the one that looks like Coca-Cola soda? And they have another one which looks like yellowish discharge. So how about yellowish discharge? How about a medical discharge? How about the Coca-Cola like discharge? Those are three.
I think
get one of those.
I think the Coca-Cola is the nice one.
No. That's that one indicates trichomoniasis.
Oh my God! I thought it's the best.
The best one is the one which is colorless and it has no odor. It has no smell. It has no odor. So the vaginal discharge should be normal and colorless. But when you see anything like a different color of a discharge, that one is yellowish. That one is Coca-Cola odor. That one is milky. Then that's an indicator that we have an infection. Another sign about what we call dysuria. Dysuria, it means urinating when you feel pain. When you go for urination, the normal passage should not feel any pain. You shouldn't feel any pain. But when you go to urinate, you feel something like resisting or burning sensations when you're urinating, or feel real pain. That's an indicator that you have bacteria in your urinary stream.
So,
and the third one,
I have a question. Sorry to interrupt you, but I have a question. Does it mean that every time someone feels like pain when you go to urinate, does it mean that you have those bacteria? Because it might be that you've not maybe slept with anyone, but you feel pain. I don't know. Can you explain more?
Yeah, actually, you're trying to trespass something behind.
Yeah.
For example, we are going to talk about that one goes under causes, but we shall do that. We shall join that later. When you feel pain, let me say you haven't slept with anyone. There are so many causes of pain. That's palliative care. Actually, that's a different topic. It depends for us what we consider. To talk that we are talking about the STIs, we consider where the pain is located. First, the second thing, when did it start? That goes under patient's history when we are interacting with the doctor with the patient.
Yeah.
The third one we shall consider about is there other accompanying sign apart from pain? When you have STIs, you have to have other accompanying signs like the discharge, like the inching, like the burning sensations, like the dysuria, and so on. But when it comes that you're just feeling pain, you haven't slept with someone, that one will go under the transmission modes of STIs, which we shall talk about later.
Oh.
Because the other causes apart from sleeping with someone, we have about contact to contact.
Yeah.
And we have about direct contact. We have about multiple sexual patterns, and we have about other causes apart from sleeping with someone. So we shall talk about those under the transmission modes of STIs.
Okay. So
let's. We have about even mother to mother.
Yeah. So
the next, the other signs I can go further with. I'll have about. I was talking about dyspareunia. Dyspareunia, it means in a simple language, it means the painful sexual intercourse. In normal sense, you shouldn't feel pain when you have intercourse with someone. But should when you feel that extra severe, yeah, exactly. It should be calm. But when you feel that extra pain, it's an indicator that your inner organs, most I'm talking about the women, your inner organs, I mean the ovaries, the fallopian tubes, the uterus, the cervix, they are containing some bacteria that lead to inflammation of the inner organs, leading to pain when you get sexual intercourse. The fourth one you have about the genital blisters. Genital blisters even about those blisters that come or that appear on the vaginal lining that contain some fluid at the head. In a normal sense, The normal private part shouldn't contain any rash. But when you get that rash or a blister or a lesion that's containing a fluid at the head, that's an indicator of an STIs. For example, what about the herpes simplex virus? Could be that. How about the syphilis? That's Piponema pallidema. It can also cause that. And what about other types of viruses that can cause such? Even candidiasis can also cause genital sores. Another one we have about the fourth smell urine. Passing out that urine that's too smelly and normal. Some people don't do self-examination, but this is simple. If you want to know that you have you STIs, you can, when you wake up at night, get a bucket, urinate in that bucket, keep that urine for some hours after morning. When you wake up, you know some people, you wake up when you feel that the whole room is having a bad smell in the morning. Wow. That's an indicator that you are passing the fourth smell urine. So normally you should have that. It should not be shouting too high in cases of odor. So when you do that examination, that one is simple. So most people should try that. Just wake up one that night, get a bucket. Those people who don't urinate in buckets, try it. Pour that urine in the bucket, leave it there. Wake up in the morning and you feel the smell. Then you will know that you're normal or you're abnormal.
Yes.
Another one we have about the genital inching. People get genital itching whereby get that the lesions I was talking about before, the itching, you feel uncomfortable and so on. Shows an indicator that you have STIs. How about the lower abdominal pain? Some people get back abdominal pain and lower abdominal pain as a sign of STIs because when the bacteria enter and the other parasites they enter your body, they concentrate in the reproductive organs. We have the fallopian tubes, we have the uterus and others, the cervix, and so on. When I talk about the main, I mean the ureters, the prostate gland, and the epidermis and others. So they concentrate those organs whereby they cause inflammation, it's getting back pain, and you get lower abdominal pain. What about the bloody discharge? I know some people may have got this before. When you go to urinate, some people pass out real blood. If not blood urine comes with blood. That's an indicator that you have what we call a kidney injury. If you have a kidney injury, some people could be about the inflammation of the ureters in the system, whereby when it comes to urinating, urine formation, that urine may come out with the real blood, if not combined with blood.
Wow.
So there are so many other signs of STIs, but mentioned but a few. Let's consider that first, because there are common signs you can consider, whereby they cut across every gender, the male and female gender, whereby also people face such signs.
Okay, so now let's get practical. If someone discovers they have an STI, how should it be managed? And how should it be managed? Or maybe let me also give you this question, and maybe beyond medical treatment, what steps can ordinary people take in their daily lives to prevent these infections?
So what should I start with? The management, the preventive measures?
The management, how should it be managed?
The management of STIs, what about the medical management, what about the lifestyle management, and how about the non-medical? There are three types of management.
Yeah.
The medical management is whereby you get the signs I've talked about up, you move to the hospital for checkup, they tell you have a certain type of infection, they will give you treatment according to the type of infection they have identified. That's the medical treatment.
Yes.
So the medical treatment, it combine, we shall talk about the antibiotics. Antibiotics, that's a class of drugs that react to bacteria. In the case you have a bacterial infection with antibiotics. How about antiviral? Antiviral, those are the drugs that respond to viral infections. For example, about the human papillomavirus, about the herpes simplex virus, about the human immunovirus. If it's a viral infection that has been detected. How about the tropical treatment? Tropical treatment is whereby we shall identify something like that's protozoa infections or parasitic infections that lead to rashes and so on. They will give you a cream to apply some tablets depending on the results from the lab. So that's a medical treatment. It's for us, the medics, that use that. But what about the management apart from the medical? When I talk about other non-medical management, I'll talk about the change of the lifestyle. For example, when we talk about the lifestyle management, for one, safe sex practices. Safe sex practices, one of the management of STIs. How? First, when we talk about the safe sex management, I will talk about you knowing your partner's status first.
Mm.
Because when someone who talked about the infected person with the infected person, when we are talking about the definition, so when I come about the safe sex practices, I'll talk about you knowing your partner's status first before engaging in unprotected sex.
Right.
The status I'll talk about the
But
HIV status, the STIs status.
sometimes you can go in a club or anywhere, and then you just land onto someone, and sometimes you don't take time to check. What advice do you give?
I get you, and it's the common cause why most of the people are taking the drugs now. It's
Mm.
because of that failure to control the feelings or to control their body systems in cases of that addiction. The advice I can give to people, mostly
Mm.
the teenagers or people that are exposed, or people who are moving in
Mm.
exposed places, such places like bars, restaurants, discotheques, and so on.
Mm.
When you're moving, you're sure you'll not get that time of taking that pattern to rotate, and you go to the hospital, test what, do what, just use a protective gears.
Okay.
Just consider using protective gears. Nothing will help to prevent STIs faster than the protective gear.
Mm.
Because, for example, I can take you to the facility, they test you, they may find out you're negative, let me say the HIV status. But when you have some you have some UTI, which they haven't tested through the urine. So I'll go, we have the unprotected sex, the HIV, you're okay, but you will leave me with the UTI.
Yeah.
So, but when you use the protective gears like the condom, it will cover the two at once. It will prevent both the blood infections and
Mm.
the inside infections. So, I advise such people to use protective gears. Mostly, let's use the condoms, and they are accessible anywhere. Even the government has offered free of
Mm.
charge.
Mm.
They give them to anyone.
Mm.
Anyone. That one is what I can say.
Okay, so I wanted to remind our listeners that our guest today, Dr. Mbuga Elvis, is a medical professional at Home Care Medical Center and Royal Pharmacy. He's sharing with us how to protect ourselves and our loved ones from STIs. They provide services like general medicine, maternal and child health, lab testing, including HIV, dental and ENT care, family planning, and minor surgeries. If you want to reach out to Dr. Elvis, you can reach out to him on via email, elvismbuga43@gmail.com, on WhatsApp, +256 74388957, or you can follow him on TikTok, health/master, and Facebook plus Telegram. You can reach out on him on Mbuga Elvis. Yeah, so I'm talking about the people who are in Uganda, because Dr. Mbuga is based in Uganda. So, Doctor, you can continue.
So we're talking about the preventive measures, we're talking about the self-sex practices.
Yeah.
Then the second one is about regular testing. It's also one of the management of STI.
Yeah.
Most of the people don't take that step of going to hospitals and they take checkups before they get signs. Because people, we talked about the economic burden.
Mm-hmm.
Someone will say, how will I use my money to go for testing when I'm not sick? What if they tell me I'm not sick?
Yeah.
Yet it's a bad thing.
Mm-hmm.
You know why it's better than us in research? You know, it's of an importance for someone to keep testing every after 3 months. Even if you're not sick, it's important to go to the hospital to know how your body is standing. But because people wait to get sick, they keep not knowing how their body status is. They wait to get sick, they'll go to the facility. So under the management, we want to teach people like you, when you get to that time, every after 3 months, go and get some regular tests about your body system. You know how your status is standing. You know about your HIV status. You know about your mental health status. You know about your psychological status. You know about your social status. You go to the hospital, you ask you, sit with the doctor, talk to him, they test you, you get your results. If there is the importance of testing, all the testing is that when we find that you have something that has enveloped in your body, we'll give you that early treatment because we will go to that early diagnosis or early detection. The problem thing, it goes back and it grows up to the time where it cannot even be managed and it will cause further complications.
Okay,
So
so
regular testing,
it's okay. It's okay. You can go.
regular testing is one of the management. And the third one, I will talk about the pre-exposure prophylaxis. For example, this goes to HIV.
Mm,
What about the PrEP and what about the PEP? That one is another topic. I will not go deep with it. But what we call pre-exposure prophylaxis? Prophylaxis means taking something before the disease invades in your body. For example, immunization is under prophylaxis. We
mm,
give the baby the vaccine before the baby gets sick to prevent.
mm-hmm,
So, what about the PEP? The drugs you give those people who are exposed to HIV couples, whereby they will not get sick. But that one is a bigger topic when we go to HIV. So it's
mm,
another subtopic on its own day. So
okay.
what about what we call pre-exposure prophylaxis? Those drugs we take to prevent the disease before we engage in sex with someone who is infected. So those are the ones I can talk about the non-medical preventive measures of STIs. Or the ways the lot of people can use to prevent the STIs in their community.
Mm.
The other question was about
It was about
money.
ordinary people can use, but also I have this question. I think it's also very important for anyone listening who is scared, maybe ashamed, maybe just diagnosed. What message of hope would you give them?
The message of hope I can come with, first and foremost, I know most of people here in Africa, as a continent,
Mm,
we fear HIV. I will talk about HIV next.
yeah.
No one will get depressed about being told that you have UTI because it's treatable.
Mm-hmm.
So, HIV, let me concentrate on HIV mostly. Those people get the mental disturbance I talked about with the depression and the stress. But what I can tell people about, what about, thank God, mainly, we've got different treatment modes of HIV currently. We thank God for that. We
Mm,
have, we have brought up many different treatment modes of HIV which were not around before. For example, we are soon fading out the use of drugs.
mm,
That the taking of drugs for HIV.
mm,
Uh, let me say the scientists have helped us. They have came up with an injector
mm.
plan or an injection that you can give someone who's HIV positive an interval 6 months. In a year,
Oh
you get two
wow,
injections.
that's life saving
Yeah.
because
So
taking
yeah,
tablets every month, or every day
yeah,
actually.
yeah, because people, yeah, people were not adhering. We were
Mm,
missing. We are causing. We are getting resistance in management of HIV
mm,
because of drug inheritance. People
mm,
were not adhering to drugs. People were getting that burden of taking the drugs every day. But we are trying to phase out that issue of drugs. People are coming up with the injection, whereby you just go, they inject you, you go home, you wait for another 6 months, you go back and inject you.
wow,
So that's a message
interesting.
of hope to many
Mm,
people who are HIV positive,
mm,
and the new cases that are recognized whereby I know the burden comes in with taking the drugs and
mm,
that depression and the isolation people get. I'm HIV positive. I'm going to die. How will I
mm,
survive? Taking the drugs every day. But things are trying to get soft. They are trying to get soft every damn night because new methods are coming in. New methods are coming in. Even
yeah,
if they brought an injection whereby it's a prophylaxis injection. They
mm,
give it to you. Even if you going to engage in sex with someone who's positive, you cannot get sick. It's also
mm.
there. They brought it
Okay, that's
currently.
interesting.
Yeah.
Interesting.
So you have two new implementations they have brought about HIV. So that's why I thank God. Some
Mm,
things new are coming up and they are still beneficial about
mm,
our health. Yeah.
interesting. Okay, now I have this one last question. When will parents open up to discuss these topics with their children, especially on the African continent? I know it's not a usual thing, like parents sit down and talk about healthy related topics with their kids.
I think according to me personally, I will talk about the stages of life. That one it will go under the milestone.
Mm,
Probably, I think when a girl, let me start with the girls. When a girl starts getting periods, or the girl starts getting the menarche, because the first day the girl gets her periods, the first time we call it the menarche. So
mm,
the first day Your daughter opens up to you that, man, I've seen this and this. Let me say that you not start the fact that the girl has started the periods. It's when you sit with her down, then you try to guide and teach her about different modes and how to prevent and how to go further with her sexual life.
Mm.
To boys, we shall talk about age of 15 roughly, because it's the age whereby most of the boys will develop body changes of something let me call the body changes, whereby the boys will start getting the beards, they'll start getting those morning erections, they'll start getting the libido and that urge to have sex, and so on. The body changes, the teenager age. So, in case you see the such signs of the body changes, it's when you have to sit down and teach or educate your girl or a boy about different modes of sexual health.
So, Dr. Elvis, thank you so much for showing us that talking about sexual health isn't shameful, but it's powerful. Maybe if you have any last word you want to tell our dear listeners regarding this topic that we've discussed, that you hoped to break down like deeply and simply so that we can understand it.
My last word about generally, I will advise the community about considering their health as the first priority.
Yeah, sure.
Don't just do anything because you said that life is short and so on and so on and so on. Let's try to consider health as something that's crucial, because life will have life at once. In case you're dead, you're gone.
Yeah, true.
So let's consider, even before you consider the money, before you consider anything, first you consider everything you do about your safety of your life and your health at large.
Exactly.
That's my advice to people at large. That's the ultimate.
Thank you so much. Thank you once again. We really appreciate the knowledge you've shared with us. And I hope those who listen to it after this live, they'll gain something out of it. And to everyone listening, silence has never protected us. Honesty, responsibility, and knowledge will. If this conversation made you think, if it gave you clarity, don't keep it to yourself. Share it. Start the conversation in your home, in your relationship, in your community. Because when you talk openly, we heal collectively. This is the Kampala Podcast, and this was the episode 1 of our Reproductive Health series. Until next time, be safe, be informed, and never be afraid to speak the truth.